You might be wondering, what is clinical somatic education anyway? I've never even heard of it. Clinical somatic education, also known as Hannah Somatic Education, was developed by Thomas Hanna, Ph.D., a philosopher and founder of the field of somatics. His methods, which became known as clinical somatic education, teach us to recognize how everyday stressors can manifest as muscle tension in our bodies and impact the way that we function physically, emotionally, and psychologically. This tension creates movement restrictions and the aches and stiffness commonly but incorrectly associated with aging. Hannah made an important distinction between what someone feels from the inside. This is their first-person experience of themselves, and what therapists, medical practitioners, and body workers see from the outside. That's called a third-person perspective. In somatic education, practitioners work with a clear understanding that the client is the ultimate expert on what it feels like to be them. Therefore, they can't be fixed, but through a process of education, they can experience long-term pain relief, improvements in everyday movement, and ultimately learn how not to get stuck in the stress of their lives. Clinical somatic education focuses on three important principles: sensory motor amnesia. This is the state of chronically contracted, tense muscles that will not relax for the long term. No amount of stretching, massage, or physical therapy makes a significant difference. These muscles have learned at the brain level to continuously stay tight in response to life's stresses. 3 universal stress reflexes. Thomas Hanna consistently observed 3 distinct full-body reflexive patterns that people adopt in response to stress. Most people are habituated to a combination of one or more of them. The green light reflexive action, invoked when there's a need to respond to ongoing demands or stress. When habituated, this reflex contributes to a host of conditions like sciatica, lower back pain, neck and shoulder pain, herniated discs, and jaw pain. The red light reflex of protection, invoked due to anxiety, apprehension, fear, or any real or perceived threat. When habituated, this reflex contributes to shallow breathing, hip and knee problems, neck pain, jaw pain, tinnitus, abdominal discomfort, and respiratory problems. The trauma reflex of compensation. This is in response to accidents or injuries. When habituated, this reflex can lead to more complicated postural imbalances and chronic muscular problems, including hip, knee, and foot pain, leg length discrepancy, an uneven gait, and sciatica. Pandiculation, the highly effective technique used to release chronically contracted muscles. This resets the brain's ability to sense, move, and voluntarily control the muscles. A pandiculation is also what your cat or dog does whenever it gets up from rest. It's like a yawn. Clinical somatics is a foundational practice of movements that can be done regularly to reset the brain and nervous system so that you can be more present, more self-aware, and more able to adjust to what you're doing, to refine, revise, and improve the way you feel and function. It prepares you to do everything you love to do, only better. Our comprehensive online course, Move with Ease, will be starting soon. Click the link we've provided to join the list so you can be notified when we open registration. I'll see you there.